Alrighty, it is now 11, so good morning and welcome to our webinar focused on the ABCs of kidney disease, a health literacy program for patients with chronic kidney disease. My name is Casey Stevens and I'm a communications specialist with Quality Insights. Everyone has entered the meeting on mute, but time permitting, we will have a discussion following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. You can also raise your hand and request to be unmuted to ask your question aloud. And now I'm going to introduce our presenters today. Andrea Moore is a health equity specialist with Quality Insights End Stage Renal Disease Networks. Leslie McGowan is the Director of Operations at Literacy Delaware. And Cindy Schermeyer is the Executive Director of Literacy Delaware. And now we'll let them start the presentation. I'm going to share my screen for you guys to see their PowerPoint.
Good morning. Good morning. Thanks to those of you who joined us. I hope others will join as we continue. This is being recorded, so if anyone has that question, this is being recorded and you'll be able to take a look at the slides and to listen later if need be. Just wanted to jump in and help us to level set a little. Casey, if you don't mind advancing to the next slide. Thank you. So just wanted to level set, like I said, and help those of you who are on the call to make the connection. You know, why now? Why are we looking to do this program? You know, as far as I know, there has not been a program like this specifically for individuals and their families, those who have kidney disease and those who are caring for family members and friends who may have kidney disease. So this in-person health literacy program is something new that we're rolling out. And one of the reasons why we're doing so is because for those of you who are on the call who are a part of the ESRD dialysis setting, you know that as you are working with patients who are on dialysis, that there are CMS goals that the network, I am here representing Network 4, you know that there are goals that CMS puts forth that the network encourages you all to reach. And some of those goals are improving education and access to home dialysis modality and kidney transplant. Another goal that CMS has for dialysis providers is reducing hospitalizations and ED visits among dialysis patients, to increase vaccinations, to increase patient engagement, and then to also improve behavioral health. And so let's help make the connection. These goals are really not possible unless the organization, that means the network, that means you all as providers, that means really all of the organizations in which a patient may navigate, that the onus is on us as an organization to make sure that we are rolling out health literate materials, but the onus is also on the patient to try to make sure that they are understanding the information in which we're providing. So it's really twofold. It's on us as an organization to ensure that the materials that we are giving our patients, the way in which we engage our patients, is in a way that they can understand. So we really can't try to have access to home dialysis and modality, and we can't expect for patients who may have a limited health literacy to navigate the kidney transplant process. We know that it is a difficult and time-consuming process. We can't expect for patients to be able to do that if they are not understanding the information in front of them. So that's one of the reasons why this program is really important. It's to help patients meet their clinical outcome and their quality of life goals, and it's to help us as providers to help our patients meet those goals. The other connection that we need to make is just advancing American kidney health. Some of you may have already heard of this. This rolled out, I believe, back in 2019, and there are really three important goals. One is to reduce the risk of kidney failure. So this is for those individuals who may have CKD, chronic kidney disease, and are not yet on dialysis. We want to reduce the risk of them having kidney failure and landing on dialysis. We want to improve access to and quality of person-centered treatment options, and then increase access to kidney transplants. So again, having patients be able to advocate for themselves, having patients to be able to take part of the discussion so that they can identify what treatment options are really going to work for them and their lives and their lifestyles and their goals. It's important that we help them to improve in their literacy. So just wanted to share that, and hopefully this is kind of level set for all of the conversation that will take place after this, but these are the goals in which all providers are working with as we work with individuals with kidney disease. And so this program is hopefully here to help us to actually meet those goals. So next slide. Thank you.
Okay, thank you. Thank you all for joining. My name is Leslie McGowan. I'm the Director of Operations for Literacy Delaware. We are a nonprofit that works statewide to support adults and their literacy skills. So for the past 40 years, we have been recruiting and training volunteer tutors to help us achieve our mission. And our goal is to have enable all of the adults that come through our program to have proficient literacy skills. And thank you. So what is literacy proficiency? We would like all of our learners to be on a 6th grade reading level. That it equals proficiency. Think of Harry Potter, being able to pick up the newspaper and read, reading for pleasure, obtaining your GED or graduating high school. And this also comes down to understanding, interpreting healthcare information as well. So it encompasses the ability to read, write, speak, and comprehend. According to the National Institutes of Health, over 25% of individuals with kidney disease, renal failure have low health literacy. And this is why we are working with Quality Insights and ChristianaCare to deliver a program to support patients, their families, and their caretakers. So enter the ABCs of kidney disease. Our program goals here are to improve patients' understanding and management of their overall healthcare. And so while this program is tailored to patients with kidney disease, we want to equip these folks with the skills and the tools necessary to navigate their healthcare journey, regardless of any of background information. So we want to increase health equity and literacy to improve health outcomes. And so this program, just to give you a general overview, will be running fall and spring sessions. Classes will be held 1 day per week on Sundays for 2 hours each session for 4 weeks. So we'll be getting our program on October 29th and run the following 3 weekends. Lunch will be provided. We are happy to incorporate some guest speakers into our program, both from ChristianaCare and some of our other partners. And we are targeting a minimum of 15 patients per class. And so just to take a look at our program schedule at the moment, like I mentioned, the first class is set to begin October 29th. The first session will talk about understanding your diagnosis, and we have an insight into the patient portal, which could be really overwhelming for folks given any type of literacy skills. Digital literacy is its own piece of the puzzle, and so we'll talk about the patient portal and all of the things that they can access through that. The second session is making sense of your diet, nutrition, and labels. Oh my. Another component that could be overwhelming to folks. We'll also talk about managing medication and putting yourself in the center of your care team and really identifying all of the folks along the way that could help support you. All classes will be held at the ChristianaCare Hospital, the main campus, from 11 to 1 p.m. And there's the address there in Newark. And all patients are welcome. Patients with chronic kidney disease and their families, especially caretakers, regardless of their health literacy, we want them involved. And so who could most benefit from this program? Right, like I mentioned that we want to welcome everyone, but you may have a patient that has had trouble interpreting their discharge summary. Some folks that have frequently missed appointments, incomplete registration forms. You know, on Literacy Delaware side, we always talk about these signs of that we see that folks that may not be able to completely understand, and completing forms is one of them. Unable to name the medication or explain dosing. Medication labels would be one of our main sessions. Folks that don't follow up with referrals or mistreatments, and really we need your help to identify those folks and kind of help us create a referral service to the program. So I would just encourage you all to talk to your patients about this program, encourage them to register. We will have lunch provided at each session. And this isn't a lecture style program. We have interactive activities, we have guest speakers, we have incentives and giveaways at each event. So no one will leave empty-handed. And the registration process is quite simple. Initially, we have, I'll share this as well after the call today, of using this QR code to enroll patients. So we'll be looking just for some basic information: name, telephone, email address, ensure that they're able to attend all 4 sessions, and we are ready to start enrolling them. Classes begin October 29th at 11 a.m. and we will have registration open until October 25th.
Fantastic. Thank you so much, Leslie.
Sure. Sorry, I wasn't sure if I had one more slide here, but I am happy to answer any questions that may pop up. Like I said, we have been working with Christiana Care and Quality Insights and the subject matter experts there to work on this program and to complete the curriculum. And we are excited to get going in a few weeks.
Awesome. If anyone has any questions at the moment, you can drop those in the chat or the Q&A feature using that tool on your Zoom menu. And before we sign off, we want everyone to please answer a short evaluation of today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. If you have a couple minutes to fill that out, we would greatly appreciate it. We also will be emailing a link to the slides from today's presentation, as well as a link to the recording. If you know a provider whose patients would really benefit from this program, you can gladly just share that with them so we can get the most folks attending and helped as possible. Alrighty, we have a question in the chat, Leslie. Do you have any additional tips or strategies for recruiting students, patients for the class?
Yeah, I think that in recruitment, healthcare folks could enroll the patients right on the spot. We don't want to just hand them a flyer and then have them walk away. We really want to get them engaged and try to recruit them right on the spot. So like I mentioned, the enrollment is very, very basic. It's their name, their email address, their phone number, just so we can reach out to them with more information. So the enrollment process is very easy and would hopefully remove any barriers to enrollment. We're also happy to enroll folks as well. If I'm happy to provide my email address and our phone number, and we can get folks registered if they, have a digital literacy barrier as well.
Fantastic, thank you. And we'll just wait a few more moments to see if any other questions come through. Righty, hearing none, thank you all so much for joining us today. Andrea, Leslie, and Cindy, thank you so much again for joining us today. We hope everyone can join us next time and are able to get your patients signed up for the health literacy class. We will also be sending out information with the recording, the slide presentation, and a link to enroll patients. So we'll make sure all your bases are covered there. Thank you so much for attending today's webinar and have a great rest of your day.
Thank you.